So welcome everyone. Thank you for joining us for today's presentation. We have the honor of having Suzanne LaBuda with us, and she's going to be talking about lung cancer awareness. So thanks, Suzanne, for joining us, and I'll turn it over to you.
Okay. Well, thank you all for joining us. Like she mentioned, my name is Suzanne. I am a lung cancer patient navigator at Altman Hospital. My role is to help patients diagnosed with lung cancer through their journey in any way that might come up. And part of that is education. And today we're going to just touch on the very basics of lung cancer. We're not going to get real deep, but just kind of to bring an awareness to the community. So the first thing we're going to cover are the cancer basics. So the first thing we're going to talk about are the cells in our body. So all the cells in our body have this ability to replicate themselves, and they divide in this pattern in this normal way, and then they die off, and then new cells take over their place. But what happens with cancer is that they don't recognize that they've reached up against that like cell, so they continue to replicate and grow, and then they start growing out of control. So as these cancer cells keep growing and making new cells, they grow out of the normal cell process, and now you have a part in the body where the cancer starts. And this can be small, or it continues to grow, and then that's when you decide that you have a tumor or something shows up that's going to warrant further investigation. So there's many, many types of cancer, and one of the big things that come up is I'm sure there's a cure for cancer, but there will never be a cure for cancer because there's so many types of cancer. You can have cancer in your lung, you can have cancer in your brain, you can have cancer in your colon, other organs, and you can even have cancer in your blood. And although they're alike in the ways that the cancer forms, they're very, very different in the ways that they grow and spread and that they're treated. So we're going to touch on what is a lung cancer. So lung cancers are generally grouped into two different types. There's non-small lung cancer and there's small cell lung cancer. If I didn't say that right, non-small cell and small cell. And they're both treated very differently. The small cell cancer tends to be a little more aggressive than the small cell cancer, non-small cell, and actually non-small cell, that's the most common. So if we look at lung cancer, here's just a diagram of the respiratory tract, starting here with your nasal cavity and gone down into your lungs. The lung cancer begins in the lungs. So this area in here where your lungs are, it can develop in any point. On your right side of your body, your lung has 3 lobes. On the left side of your body, your lung has 2 lobes. And it can start growing in any of them. It can start growing in the lymph nodes. And then what can happen, it can also spread to the other areas outside of your lungs. So lung cancer can go to the brain, it can go to the kidneys, it can go to the adrenal glands. And when the cancer starts to spread outside of the lungs, that's called metastasis. It's also referred to a lot as you might hear that the cancer has a MET. And that's just a short term for that MET. So with lung cancers often being caused by smoking, we're going to take a look here at what a lung cancer looks like. So obviously the nice pink healthy looking lungs there are those of someone who doesn't have lung cancer who hasn't smoked. The darkened one, these are true pictures. This is really what lung cancer and smoking can do to a lung. And the purpose of your lungs is air exchange. So when you impede that air exchange, you're going to have a lot of issues, not even just cancer, but when you're a smoker, that's when you're going to start developing respiratory problems. And it's evident when you see what the lung cancer does, or excuse me, what smoking does to the lung. So having touched on that, we're going to see now what are the risk factors for lung cancer. The number one risk factor for lung cancer is smoking. 80 to 90% of all lung cancers are linked to smoking. Other tobacco products such as cigars and pipes, those also increase your risk for lung cancer. And as it says there, people who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from lung cancer than people that don't smoke. Even just smoking a few cigarettes a day, people will lead on to believe, I don't smoke that much, so I think I'm probably going to be okay. As that picture we had looked at, you see what smoking does to your lungs. So there's no amount of cigarette smoking that is healthy or that is okay. And then when you do quit smoking, you do have a lower risk of lung cancer than if you continue to smoke. But once you quit smoking, you still have a high risk for lung cancer. So it's imperative that you stop smoking. There's many programs out there, and Altman has smoking cessation programs that can help you quit smoking, because that will be your #1 risk factor. Now, obviously, smoking is very common for lung cancers, but cigarette smoking is also related to cancer of the mouth, the throat, the esophagus, colon, liver, kidneys, very common too with smoking. So the risks of smoking far outweigh just lung cancer. It can affect every system in your body. Another factor of lung cancer is secondhand smoke. And this has really become apparent over the last probably 20 years or so. Those of us that are younger grew up with our parents smoking all around us, people smoking in the car. I do go out and talk to school-age kids in the community, and many of their parents are still smoking in their house. Secondhand smoke is extremely dangerous. It's the same almost as smoking, because you are inhaling that. So just because it's not going through the filter, the smoke is still going in there. So it is dangerous to be around secondhand smoke. When you breathe that in, it's just like you're smoking. In the United States, 2 out of 5 adults who don't smoke and have children who are exposed to secondhand smoke, about 73,000 people who have never smoked die each year from lung cancer. So the secondhand smoke in the home, around your kids, in the car, it's extremely dangerous. And another thing people don't often think about is when they're smoking is those pets in their home. If you're smoking and you have pets in your home, it's affecting it too. There is another, just a little footnote, there is third-hand smoke, and that's the smoke that gets into your fabrics. If you go into a house or a car of someone that doesn't smoke, you'll often smell that cigarette smoke, or you smell it on their clothes. If you lay on that a lot, you can get some of those particles can be emitted. That's why you're smelling it. So even third-hand smoke is dangerous. Another huge topic, especially in northeastern Ohio, is a radon gas. What radon is, it's a natural occurring gas that's in our soil and it's in our rock. So those of us that have basements in our home, you should always have your home checked for radon. The Environmental Protection Agency says radon causes about 20,000 cases of lung cancer a year. So I know for myself, I just contacted someone, you have them come out, they set up a monitoring system in your basement, and they'll let you know, especially if you have a finished basement or you have kids that play down the basement and you're in your basement, you're exposing yourself to that radon gas. And it's a very, very simple, quick fix. They just come in and they just put it like an exhaust so that you can get some of that radon gas out. And don't rely on, well, my neighbor had theirs tested and it was fine. You can have a house that has a healthy level, and the very next door neighbor that's close can have high levels of radon. So it's real important that each home gets the radon checked. Nearly 1 out of every 15 homes in the United States is felt to have high radon. So again, the importance of checking your radon is extremely important. You can just log on and Google it, and it'll give you different places in your area that can check it. Another source of lung cancer are workplaces, and those are really big. Asbestos, I think we've all heard about because it's just so well publicized and there's a lot of advertisement about it. But there's other things like diesel exhaust, or individuals that work around silica or chromium. Silica is like the dust that forms, like if you're sawing granite or something like that. Anything that builds up that little bit of dust that you're going to inhale can also cause different lung cancers. And then a personal or a family history of lung cancer. It might be higher if your parents or siblings have had lung cancer. It could be true because they smoke and then you also were around that smoke. So sometimes there's a familial history. Some cancers carry a genetic trait that puts you at more risk. Lung cancer is not that. It's more likely that you're in the same environment. So lung cancer is the biggest cancer killer in both men and women. Lung cancer kills more people every year than prostate, breast, and colon combined. It's often overlooked, and it's not often one to be talked about much, but it is a huge, huge factor. And awareness and screenings are extremely important. So what can you do to reduce your risk of lung cancer? Well, obviously we talked about that. Don't smoke. Avoid the secondhand smoke, get your home tested, and then be careful at work. Whatever your work guidelines are, make sure that you follow them. Another huge, huge thing that has come across for lung cancers, because we have screenings for our colon cancers, we have screening for breast cancer, and there are screenings for lung cancer. So screening just means that you don't have the symptoms, but you're going to kind of keep watch of it. And that the important thing to remember with lung cancer is the sooner you find lung cancer, the more likely you are to cure it. And there's a difference between curing cancer and treating cancer. Many cancers can be treated, but they can't all be cured. And if you get a screening and we find lung cancer soon enough, you can be cured for it. So the only recommended test for a screening test for lung cancer is a low-dose CT. And what a low-dose CT is, if you've ever had a CAT scan, it's just like that, but it uses low amounts of radiation. And it goes through and it looks over your lung to see what may be there. There's certain guidelines that recommended on who should be screened. So according to the U.S. Preventative Task Force, these are the recommendations. These recommendations are also recognized by most insurance companies as well. So if you have a heavy history of smoking, and that's generally a pack a day, they are currently reviewing that though, to see what we could possibly do to lower those, because we are seeing a lower trend in the ages of lung cancers. If you are smoking now or you have quit smoking, even in the past 15 years. So remember, we touched on a little earlier that even if you quit smoking, you're still at risk. And that's why we bring that back for that 15 years so that we can keep an eye on that. So what you do is you come in, they'll do your CT scan. You just need it ordered by your doctor. It's paid for by most insurance companies. And they'll look at that. Now, like with any type of test, you can get some false positives or areas of concern. Many of our low-dose CT patients are just, we keep bringing you back every year. We just keep watching, and we keep watching until you fall off the age. 77 is generally the age limit. Sometimes Medicare will extend it to 80, but once you fall off that, but during that time, we can watch you every year. And then if we see something that we're just not sure about, we might have you come in and we're going to redo it again in 3 months or 6 months, or oftentimes we do find something that's concerning and we biopsy it and it's a lung cancer. But the good thing is that it's been detected early. It's been detected before this can spread. And your treatment options are then surgery, which is always what we like to do, because that's it. You remove all the cancer and you're done. And then you just go on to monitoring. So low-dose CT screening is huge, and any of your primary care physicians will be aware of it. If you are a smoker, we'd be more than happy to talk you through that and help you with that. And the only other thing I want to touch on, although I don't have slides for it because it's relatively new, is the onset of vaping. Vaping, e-cigarettes, hookahs, or whatever the terminology that you want to use is kind of looked at as the okay, safe way to smoke. And a couple things to keep in mind are, initially way back when the e-cigarettes came, through the American Cancer Society, it was felt that by e-cigarettes, that would help you decrease your smoking. So move to the e-cigarette and bring your smoking down to where you quit. Well, what has happened is people that never smoked started e-smoking. And the thing with all those liquids and the vapor, it creates this vapor, there is in most of them a nicotine, and the nicotine is what is so addictive. It's rampant in our schools, especially our middle schools, because now they market them as flavor. You can get bubble gum and fruit and all these things. So there's a huge concern and a very big risk, because again, you are inhaling that vapor. And even in the ones that are claimed to be no nicotine, they have found traces of nicotine, so it brings you back. And then those vapors, you know, anytime you inhale something that's not healthy, you continue to do damage. So you could, you know, do some type of damage to your lung. So this is just a very, very, very brief, quick introduction into lung cancer. I'd be glad to answer any questions for you now, or I can, and at the end, I'll also leave my telephone number so that you can call our navigation line and get any questions answered. So I am just going to tell you that number. Any questions can be directed to the patient navigator, which would be myself, and that's a number here at Altman. It's 330-363-6891, and I'd be glad to answer any questions for you.